Hey everyone, welcome back for another deep dive.
Ah.
Keeping up with all the changes in healthcare can be a real challenge, right?
Oh, absolutely.
Whether you're trying to wrap your head around some new medical gizmo or, this whole AI thing that seems to be everywhere you look these days, it can
Hmm.
feel like a lot to process.
Yeah.
But that's exactly why we do these deep dives. We take those sources you've sent our way and we sift through them, pull out the key takeaways, kind of like your personalized cheat sheet to understanding the really important stuff.
Absolutely.
So today we're tackling two big topics, building on what you sent us. First up, we're looking at a more structured way to approach how new medical devices actually fit into the whole healthcare ecosystem.
It's complicated, right?
It really is. So we need a way to kind of unpack all those layers.
Yeah.
And to give you a real world example, we're going to be using the Amy PCA postoperative pain management pump from Dakin Medical.
And I think what's really interesting about this specific pump is that it's controlled with a smartphone. So it introduces
The big
the
shizzle.
whole set of considerations. Yeah.
For sure. And then for our second topic, we're going to dive into the potential and also the challenges of integrating artificial intelligence into critical care.
Mm.
And specifically, we'll be focusing on how AI might be used in managing sepsis.
Yeah.
And we'll be taking a close look at a tool called the AI Clinician.
Mm.
So by the end of this deep dive,
Hopefully you'll have a solid grasp on these topics.
right, we're aiming for those aha moments, those surprising facts, and a real understanding of what this means for the future of healthcare and how patients are cared for.
Exactly.
And we'll try to keep it conversational, not like you're back in school listening to a lecture.
Absolutely.
Okay, so let's start with the integration of new medical devices,
Right.
figuring out how they actually fit into the existing healthcare system.
Yeah.
One of the big ideas that came up in the material you sent was this concept of clinical pathway mapping, or CPM. Now, this isn't just about, you know, focusing on the device itself in isolation, is it?
No, not at all.
It's about the bigger picture.
Yeah, clinical pathway mapping really is a way to sort of visualize and understand all the moving parts when you bring in some new tech into a healthcare setting.
Yeah.
It's kind of like, when you're watching a play, it's not just about the actor who just walked on stage, right?
Right.
It's about how they fit into the entire scene, the whole production.
Right.
So CPM looks at the device itself, of course, but it also considers all the people involved. The doctors, nurses, patients, the tasks they perform, the other tools they use,
Yeah.
the physical environment where all of this takes place, and even those bigger organizational conditions like hospital policies and guidelines.
So it's really about understanding the Whipple effect.
Exactly.
You introduce one new element, and it's going to interact with a whole web of other things.
Mm,
And the purpose of CPM is to sort of anticipate what those interactions might be, right?
precisely. The goal is to figure out how that new device will impact the way things are already done,
Mhm.
the workflows, patient safety, ultimately the quality of care that's delivered.
Right.
And what's interesting is that some people argue that the very act of mapping these pathways out can be considered a healthcare intervention in itself
Oh, interesting.
because it can help standardize care for certain conditions. You're essentially creating a blueprint for how to do things consistently.
That's a good point. If you can visualize the whole process,
Right.
you can identify potential bottlenecks, you can make sure everyone's on the same page.
Mm-hmm.
Now, to make this concrete, the study you shared focused on the Amy PCA pump as a case study. Could you walk us through how this device actually works?
Sure. The AMI PCA pump from Dakin Medical, it's designed for managing pain after surgery.
Okay.
It allows patients to control their own pain relief by giving themselves those small doses of opioid medication,
Okay.
like morphine, for example. It's intravenous, so it goes directly into the bloodstream. But what sets it apart is how it's actually operated. You've got the main pump unit, and there's a separate button for the patient to press to get a dose.
Okay.
But healthcare professionals control the dosage and monitor everything through a dedicated smartphone app
Hmm.
called Amy's Window.
Interesting.
And then there's a communication piece as well that connects the pump to the smartphone wirelessly.
Oh, okay.
So unlike, the traditional PCA pumps that have those screens built right in.
Like by the bed.
Right, exactly.
This, yeah, all done remotely
Exactly.
through his smartphone. That's a pretty big difference.
It is.
That changes a lot.
It does, and it's that difference that makes it such a valuable case study for CPM, because it really forces us to think about how this new approach might actually work in a busy hospital setting.
Right.
So to explore that, the researchers conducted this study across 4 NHS trusts in the UK.
And for those who may not know, NHS stands for the National Health Service, which is the UK's publicly funded healthcare system.
Yes, that's right. And they interviewed a range of stakeholders. They had consultant anesthetists, an intensive care consultant, an anesthetic trainee, and pain nurse specialists.
Okay, so getting a good range of perspectives there.
Yeah, trying to get a comprehensive view.
And how did they go about understanding how this new pump might fit in? I mean, it wasn't just a casual chat, right?
No. It was very structured. They started by presenting the AMI PCA pump to each participant, explain what it does, how it's used,
Okay.
and then they used these open-ended questions to really dig into how the pump might interact with the different elements of something called the work system model.
Okay, and what's the work system model?
It's essentially a framework for understanding how work gets done in complex systems. It looks at 5 key elements: the individuals involved, the tasks they perform, the tools and technologies they use, the physical environment, and the organizational conditions.
Okay, so it's like a way to break down a complicated system into more manageable pieces.
Right, and it helps you think about how those pieces all fit together.
Right.
So they asked questions that touched on each of these elements, like how might this pump affect the nurse's workload? What new tasks might it create? Are there any potential safety concerns? How might the hospital's layout impact its use? Things like that.
Okay, so really trying to get a sense of how this seemingly simple change using a smartphone to control a pump would actually play out in the real world.
Exactly, yeah. It's about thinking beyond the technology itself and understanding how it interacts with the human and organizational context.
Makes sense. Now, what did they do with all the information they gathered? How did they analyze it?
Well, they used a few different methods. First, they did process mapping
Oh,
to visually lay out the clinical pathways as they were described by the clinicians they interviewed.
so literally mapping out the steps involved in managing postoperative pain.
Right. And then they added something called swim lane diagrams to those maps,
And interesting.
which allowed them to show how those steps were linked to the 5 elements of the work system model.
Right, so you can see how each step might affect or be affected by the individuals involved, the tasks, the tools, the environment, and the organization.
Exact.
That's a really clever way to visualize it.
Yeah, it is. Then they used the framework analysis method,
Okay.
which is a qualitative data analysis technique that helps you identify themes and patterns in textual data.
Okay.
So in this case, they were looking for recurring ideas or concerns that came up across the different interviews.
Right, like maybe multiple people mentioned the same worry about connectivity or training needs.
Exactly.
And then finally, they did a scenario-based analysis
Yes.
where they imagined different ways the pump might be used in practice.
Right. Because there's not necessarily one right way to implement a new technology, right?
Right.
So they wanted to explore the potential advantages and disadvantages of different approaches.
Okay, so what were some of the scenarios they came up with?
Well, they identified 2 main possibilities. The first scenario was where a single smartphone is dedicated to the pump and stays with the patient throughout their entire journey,
Okay.
from the recovery room to the ward.
Okay, so one phone, one pump, one patient.
Right. And the second scenario was where the pump itself is moved between units
Okay.
and is then connected to whichever authorized smartphone is available in that particular location.
Oh, interesting. So kind of like a hot swapping situation.
Yeah, exactly. And then they analyze the pros and cons of each scenario through the lens of that work system model.
Right. So looking at how each approach might impact those 5 key elements.
Yeah. So, for example, in the first scenario with the dedicated smartphone, one benefit for the individual patient could be a more consistent experience because they have the same nurse and the same device throughout their recovery.
Okay, that makes sense.
But a potential downside could be, if that specific smartphone is needed elsewhere, it's not available.
Right. So it creates a potential resource bottleneck.
Exactly, yeah. And then in the second scenario, where the pump is moved between units, it might maximize the availability of smartphones.
Right, because you're not tying one phone to a specific patient.
Yeah, but then it introduces this possibility of fragmented care.
Right, because the patient might interact with different nurses and have to explain their needs over and over again.
Exactly. So it really highlights how there are trade-offs with both approaches.
Yeah. It's not a simple solution.
Right. And these are the kind of things you can start to tease out when you use this CPM approach.
Yeah, absolutely. Now, what about the impact on the tasks involved?
Well, that varied depending on the scenario. For example, if you have that one dedicated smartphone staying with the patient, it might simplify some tasks.
Like handovers between nurses.
Exactly, yeah. But it could also create new tasks, like making sure that that specific phone is always charged and accessible.
Right, because now you have this one critical piece of equipment that has to be managed carefully.
Exactly. And then in the second scenario, where the pump is being moved around,
Yeah.
it could lead to more frequent handovers of the pump itself,
Right.
which raises questions about who's responsible for things like checking the battery level and making sure it's properly connected to the new smartphone.
And what about the tools and technologies element, the pump itself and the smartphones? What came up there?
Well, in both scenarios, there were concerns about the number of smartphones that the pain management team would need to have available.
Okay.
There was a worry that there might not be enough to go around.
Right, especially if you're using that dedicated smartphone model.
Right, exactly. And then the battery life of both the pump and the smartphones was a big concern.
That makes sense.
The pump often needs to be plugged in,
Mm-hmm.
but charging points might not always be conveniently located.
Especially if the patient is being moved around.
Exactly, yeah. And then you have the issue of connectivity. Some features of the AMI-PCA system require an internet connection,
Okay.
which can be unreliable in certain parts of NHS premises.
That's a really practical concern.
It is, yeah.
I mean, you can have the most cutting-edge technology in the world,
Right.
but if you can't get a signal or the battery dies, it's not going to do you much good.
Exactly.
What about the physical environment? How does the actual layout of the hospital come into play?
Well, the physical environment raised some security concerns, particularly in that second scenario where the pump is moved between units.
Okay.
There's a need to make sure that it's not tampered with or lost.
Right.
And then from an organizational standpoint, both scenarios highlighted the need for training.
Okay.
Bedside nurses might need specific training on how to use and troubleshoot this smartphone-controlled pump.
Right, because it's different from the traditional models.
Yeah, it is. And another concern was how easy it would be to quickly see how much medication has been given in an emergency situation.
Okay.
Accessing that information on a separate mobile device could be more complicated than just looking at a built-in display.
Yeah, those are all really important considerations. Now, it wasn't all doom and gloom, was it?
No, not at all.
What were some of the advantages that the study highlighted?
Well, the portability of the AMI-PCA was seen as a big plus.
Mm-hmm.
It's handheld, it's small, and that could potentially allow patients to get up and move around sooner after surgery.
Which is generally a good thing.
Right, exactly. And the smartphone app, Amy's Window, offers some real benefits.
Okay.
It can display all sorts of patient data, like how many times they've pressed the button for medication, how much they've received.
Okay.
And this information can be downloaded and added to their electronic health records.
So it's not just about managing pain, it's also about collecting valuable data.
Exactly, yeah.
And that data can then be used to improve care.
Right, and that's one of the things we're always looking for with new technologies.
Right.
Can it help us be more efficient, more effective?
Yeah.
And in this case, it seems like it has the potential to do that.
So this whole study really illustrates how a seemingly simple change, like using a smartphone to control a pain pump,
Right.
can have these really wide-ranging effects across the entire healthcare system.
It does. It does.
What was the main takeaway from this part of our deep dive?
Well, the study really emphasized that clinical pathway mapping is a really valuable tool for visualizing all the different factors that come into play when you introduce a new technology.
Mm-hmm.
It helps you to anticipate potential problems and identify areas where further research and development might be needed to ensure smooth and successful integration.
Right, so it's kind of like a proactive approach.
Exactly.
Thinking through all the angles before you even bring the device into the hospital.
Absolutely.
Okay, so that's our look at integrating new medical devices. Now let's shift gears a bit
Right.
and move from those tangible devices to something a bit more abstract,
Mm-hmm.
the world of algorithms and data. We're going to talk about artificial intelligence in healthcare,
Okay.
specifically in the context of managing sepsis. And I think what's interesting here is that the success of AI in healthcare isn't just about the algorithms themselves.
No, it's not just about the math.
It's about much more than that.
Yeah, it's about trust. It's about how reliable those recommendations are in real-life situations.
Right.
It's about the quality of the data that the AI is learning from.
Right.
All those things play a role.
Absolutely. And that brings us to the pilot study you shared on the AI Clinician tool for managing sepsis in intensive care units, or ICUs.
Yes.
So what was the main goal of this study?
Well, this study involved in-depth interviews with doctors and nurses who work in ICUs across 3 different hospitals in London.
Okay.
And it had 2 main aims. The first was to really understand how sepsis is currently managed in these settings.
Okay.
And to identify those specific points in the process where an AI tool like the AI Clinician could potentially be helpful.
Right. So mapping out the existing workflow and then figuring out where AI might fit in.
Exactly.
Okay, and what was the second aim?
The second was to look at how likely clinicians would be to actually follow the recommendations made by the AI,
Right.
taking into account things like the time of their shift, their level of experience, and how decisions are made as a team.
Right, so those human factors, again,
Yeah, exactly.
coming into play.
Yeah.
Now, before we go any further, could you remind us why sepsis is such a significant challenge in healthcare?
Sure. Sepsis is a life-threatening condition that arises when the body's response to an infection goes into overdrive.
Okay.
It can lead to organ damage and even death if it's not treated quickly and effectively.
Right.
It's a leading cause of death worldwide, and it places a huge burden on healthcare resources.
So early detection and prompt treatment are really crucial.
Absolutely, yeah. The problem is recognizing sepsis early on can be really tricky because the symptoms can be quite vague.
Okay.
And even when it is diagnosed, deciding on the best course of treatment can be challenging.
Right.
The mainstay of treatment involves intravenous fluids and medications that help raise blood pressure, called vasopressors. But there's often a lot of debate about the right amount of fluids and vasopressors to give and when to give them.
So it's not a one-size-fits-all situation.
No, not at all. And we don't currently have tools that can truly personalize treatment based on a patient's individual needs.
Right, and that's where the AI clinician comes in, right?
Yeah, that's the idea.
What exactly is this tool and how does it work?
The AI clinician uses a type of machine learning called reinforcement learning.
Oh.
To basically learn how to make the best decisions about fluid and vasopressor management in patients with sepsis.
Okay.
It's been trained on huge data sets from ICUs around the world.
Okay, so it's learning from real patient data.
Exactly.
And the goal is to use that learning to provide real-time recommendations to clinicians to help them make those tough decisions about treatment.
Yeah, and studies have actually shown that on average, the AI clinician can outperform human clinicians when it comes to figuring out effective treatment strategies.
Wow, that's pretty impressive. So you're saying this AI tool can potentially make better decisions than experienced doctors?
Well, it's not that straightforward. Remember, it's been trained on these massive data sets.
Right.
So it's seen a lot of different cases, a lot of different outcomes,
Okay.
and it's learned from that experience to identify patterns and make predictions.
But it's still just a tool, right?
Yeah.
It's not a replacement for human judgment.
Exactly. And that's why this pilot study focused on those human factors.
Right, because even if the AI can technically make better recommendations,
Yeah.
if clinicians don't trust it, if they don't understand it, it's not going to be very useful in practice.
Exactly. Yeah. And it's not just about trust and understanding either. It's also about how the AI fits into the existing workflow.
Right, back to that work system model.
Right.
How does it interact with the individuals, the tasks, the tools, the environment, and the organizational conditions?
Exactly. It's all interconnected.
Now, how did they go about evaluating those human factors in this study?
They used a qualitative approach, meaning they relied on in-depth interviews to gather rich, detailed information.
Okay.
And the interviews were structured around realistic scenarios.
Okay.
So they weren't just asking hypothetical questions.
Right.
They were presenting clinicians with real-life patient cases.
Interesting. So they were really trying to simulate how the AI might be used in a real clinical setting.
Exactly, yeah. And there were actually two sets of interviews. The first set was focused on understanding the typical processes for managing sepsis in the participating hospitals.
Okay, so kind of establishing a baseline of how things are currently done.
Yeah. And then the second interview was where they really got into the nitty-gritty of the AI clinician.
Okay.
They presented the clinicians with this real patient case.
Okay.
And they showed them the actual treatment that was given by the human doctors and nurses at different points in time.
Okay.
And then they also showed them what the AI clinician would have recommended at those same time points.
Interesting. So they were comparing the human decisions to the AI's recommendations side by side.
Exactly.
Yeah.
And then they asked the clinicians to talk through their thinking.
Okay.
Why did they make the decisions they made? How would they have responded to the AI's recommendations?
Right. Really getting into their decision-making process.
Exactly, yeah. And the participants in the study included junior doctors, senior doctors, and bedside nurses.
Okay.
So, again, getting those different perspectives from different roles within the ICU team.
And how did they analyze all that interview data?
They used the framework analysis method again, which we talked about earlier.
Right.
It's a systematic way to identify themes and patterns in qualitative data.
Right, so they were looking for those common threads,
Exactly.
those recurring ideas or concerns that emerged across the different interviews.
Yeah. And the framework analysis method provides a really structured way to do that.
Okay, so what did they find out? How might this AI clinician tool actually fit into the reality of managing sepsis in the ICU?
Well, the study outlined those typical steps involved in managing a patient with sepsis,
Okay.
starting from recognizing the signs and symptoms,
Ah.
then giving those initial treatments.
Like fluids and antibiotics.
Right, exactly.
Right.
And then closely monitoring the patient's response,
Mm-hmm.
deciding if they need to be admitted to the ICU,
Okay.
making adjustments to their treatment as needed,
Right.
and then eventually de-escalating the level of support as they improve.
So it's a whole process.
It is, yeah. And they emphasize that this process isn't always linear, meaning that patients don't always progress in a predictable way.
Right. Every patient's different.
Yeah. And they identified 5 key areas where it's particularly difficult to provide optimal sepsis care.
Okay. What were those areas?
So the first challenge is figuring out the right amount of fluids and vasopressors to give.
Okay. Which we talked about earlier.
Yeah.
It's not always clear cut.
No, it's not. And then the second challenge is that patients don't always respond to treatment in a linear way, meaning they might get better, then worse again.
Okay.
It's not always a straight line to recovery.
Right. And that can make it hard to adjust treatment appropriately.
Exactly, yeah. Then the third challenge is deciding when a patient really needs to be admitted to the ICU,
Okay.
which can be a tough call sometimes.
Right, because ICU beds are a limited resource.
Right. And then the fourth challenge is that nurses have limitations on how much they can independently adjust the dose of vasopressors.
Okay.
They often need a doctor's order.
Right, so it can create delays in care.
Exactly. And then finally, there's often a lack of clear agreement on the best targets for things like blood pressure and lactate levels,
Okay.
which can make it hard to know if the treatment is working.
So those are the 5 key challenges.
Yeah.
And how did the participants in the study think the AI clinician might address those challenges?
Well, they thought that the AI could potentially provide more precise treatment parameters and goals.
Okay, so kind of taking some of the guesswork out of it.
Right, yeah. And they thought this could be particularly helpful in those early stages of treatment,
Okay.
when those decisions about fluids and vasopressors are so critical.
Right.
And some of the participants felt that it could be especially beneficial for bedside nurses
Okay.
by giving them more guidance on how to manage vasopressors within those agreed-upon guidelines.
Okay, so empowering nurses to make more timely adjustments.
Exactly, yeah. But one thing they noted was that the AI clinician hasn't been tested in medical wards yet.
Okay, so only in the ICU setting,
Yeah.
where there's closer monitoring and more specialized staff.
Right.
What about the impact of the AI clinician on decision-making? How did they think it might affect the roles of nurses and doctors?
Well, for nurses, the study highlighted how important it is to think critically about the AI's recommendations.
Okay, so not just blindly following whatever the computer says.
No, not at all. And they were particularly cautious when the AI's suggestions didn't align with the patient's overall treatment goals.
Okay, so if it seemed like the AI was missing something.
Right. Yeah.
Or if they didn't understand the rationale behind the recommendation.
Yeah, or if it just felt off.
Right.
They were more likely to question it.
Okay.
For example, some nurses expressed concern about the AI suggesting more fluids, even when they were worried about the patient being overloaded with fluids,
Okay.
or if the patient's urine output was low.
Right, because those are signs that the kidneys might not be functioning properly, and giving more fluids could actually make things worse.
Exactly, yeah.
Yeah.
And in those situations, they said they would be more likely to consult with a senior colleague.
Okay, so seeking a second opinion
Right.
and relying on their own professional judgment.
Exactly, yeah. Which I think really highlights that human element, that
Yeah.
intuition and experience that's still so important in healthcare.
Absolutely. And what about the doctors? How did they view the AI clinician?
Well, the study found that they were most likely to follow the AI's recommendations when they agreed with their own clinical assessment.
Okay, so when the AI was basically confirming what they were already thinking.
Right, yeah. But even then, they often still wanted to get confirmation from a colleague.
So still seeking that second opinion.
Yeah, especially during night shifts when there might be fewer staff available.
Right, when they might feel a bit more isolated.
Exactly. And they also really emphasized the importance of continually assessing the patient's response to treatment.
Right, so not just blindly following the AI's recommendations,
Yeah,
but using it as a guide and adjusting the treatment as needed.
exactly.
So it sounds like they saw the AI clinician more as a potential advisor than as some kind of ultimate decision maker.
Right, yeah. It's another tool in the toolbox.
Yeah. So what was the overall conclusion about how this AI clinician might be integrated into the ICU setting?
Well, the key takeaway was that while AI has huge potential in managing sepsis,
Hmm.
there are valid concerns about simply following recommendations without understanding the context
Right.
or without critically evaluating whether they really make sense for that specific patient.
Right. So it's not about replacing human judgment. It's about augmenting it,
Exactly.
providing clinicians with more information to help them make the best decisions.
Right. And the study really emphasized the need for education and training
Okay.
so that healthcare professionals understand how these AI algorithms work and can use them responsibly.
Right. Because if you don't understand how the tool works, you're not going to trust it.
Exactly. And you're less likely to use it effectively.
And they also acknowledged that this was just a pilot study
Right.
with a small sample size and a single patient case.
Yeah. So more research is definitely needed.
Right. But it's a really fascinating first step in understanding how AI might be integrated into critical care.
It is.
So both of our deep dives today, whether we were looking at that new medical device or that sophisticated AI tool,
Right.
they both seem to come back to the same central idea. It's not just about the technology itself.
Yeah.
It's about how that technology fits into the broader healthcare system.
It's about the people, the processes, the environment.
Right. It's about that whole ecosystem.
Exactly. Yeah.
And despite all the technological advancements, the human element remains absolutely critical. The judgment and experience of healthcare professionals, their ability to understand the nuances of each individual patient's situation,
Right.
and the importance of trust when working with these new technologies, whether it's a smart pump or an AI assistant, those things are essential.
Absolutely. That human touch is still so important.
So imagine a nurse trying to find the right device to manage a loved one's pain after surgery, and they're fumbling through menus, struggling with the technology. That delay, that frustration, that's exactly what this kind of clinical pathway mapping aims to prevent.
Right. By thinking through those challenges in advance.
Exactly. So as we wrap up this deep dive, I want to leave you, our listeners, with a question to ponder.
Okay.
Considering all the potential benefits we've discussed and the very real challenges in integrating these innovations safely and effectively, what do you think is the single most crucial factor in ensuring the successful integration of future healthcare technologies?
It's a big question
It is a big question,
with no easy answers.
but it's one worth thinking about. Thanks for joining us for this deep dive.
Thank you.
We'll see you next time.
See you then.
Bye.